Hi.
Hi. Hello. How are you guys today?
Fine, how are you?
I'm good, thank you. So, would you like to introduce yourself and let us know what you do?
So, my name's Liz, I'm the CEO of the National Association of Care and Support Workers, and I'm also a domiciliary care provider in Hampshire.
Cool. And you are?
I'm Sue Jones, the Director of Social Care from the Institute of Health and Social Care Management, and we are here today supporting and partnering with Liz at NACAS and the Voluntary Care Professional Register.
Fab. So, you're both talking today. Do you want to talk a bit about what you're talking about?
Yeah, so last year when we were here, we had a session investigating the desire for a voluntary care register for care professionals in England, and we had it was quite a lively debate, and I think the consensus was yes. So we've actually taken it a step forward now, and we've launched one. So a year down the line, we've launched one. We've had really positive feedback. We're only a month into it because we had a bit of a technical glitch, so we had to unlaunch and then relaunch quickly.
You won't say anything about that. It's fine.
No.
Yeah.
Oh, okay, that's right. Yeah.
It's fine. It's lovely. It's working.
Yeah, it is brilliant. Yeah, it's fine. Yeah, but anyway, but really, just to say, although we've been going a month, actually we've been going less than a month, and we've got on probably approaching 100 on it already. We understand it's not the sole answer. We know that. We know ideally it needs to be mandatory, and we all agree. However, it's better than nothing, and there certainly seems to be a need for it out there. So at 12:30 today, I'm having a little talk on why I think. I'm a registered nurse, so it goes through me registration like Blacklock.
Yeah. I mean, I think what's interesting is that I've been in the social care sector about 7 or 8 years now, and there's been lots of ideas and not much action. So it's great to see someone actually. Because I remember sitting down with you last year and talking about this.
What I didn't want,
through.
What I didn't want to do is be one of those people that talk, and not actually. That's not me. I'm a bit of a fixer, and as much as I can. But I can't bear the idea of just talking about it and not actually put my money where my mouth is. I mean, I really hope the jungle drums are going actually more than they were this time last year. I've already had a chat with the Department of Health, so clearly the jungle drums are moving. So we've just got to keep getting beating louder, really. But we've had really good support from everyone that's passed the stand, and really good, and zapping away we were yesterday. So yeah.
So how's your organisation helping support this? How's your organisation helping support this?
Well, we were very much we actually delivered the people plan. So that was very much something that we were taking and bringing forward. Obviously, I'm new in post, so I only started in September, and the people plan was all Adam's work, and that was absolutely brilliant. And this really is following on from that. So, my view is that care should be seen as a profession that people aspire to work in and be part of. So if we don't have something that actually takes that sector forward in terms of profession, then that's actually going to be really difficult to achieve. So as an institute, absolutely believe that that's the way forward.
It's great for organisations like yours to support it, and I guess you are able to then share that with your members and
100%. We have to take this forward. We can't rely on governments to make this change. We've actually got to do, and it's fantastic that NACAS and Paul and Liz are doing this. It's just unbelievable. It's really good.
What level of care worker should adopt this? Is it manager right through?
I think what we don't want to do is put barriers up. We don't want to say to you, you've got to have a level 3 or you can't register, because actually there are many people out there who have just got a passion for care. They just want to go out and look after people. And actually not everyone's academic, not everyone wants to climb the career path. I think as long as they've got the passion, the compassion, the understanding of what it means to be in the industry, then you need to be on the register. It's not just about education, it's about the actual work ethic as well. I mean, great if you want to go on and do level 2, level 3 or whatever, that's amazing. We need it, but we need everyone. There are not enough carers. We know there are not enough carers in this country, and we can't afford to be putting barriers up saying you can only come on if you've got a level 2, level 3. Because I know in Wales, I believe that has been the situation, and it is a barrier, and they probably leave some really valuable people that way. And I think maybe if people are seen as professional, if they're deemed as professional, that would encourage them to go on and do that extra training, education. But if they're actually just seen as just the carer, then why would they? What's the incentive to do that? So the answer is the passion and the care is the qualification.
And I think the nice thing that you're actually doing is thinking ahead of that as well, in terms of the, in terms of the qualifications and the training, what's the next steps, and that's really where we're absolutely partnering with that, because we're all about the management and the training side of things, and we're really hoping to work together to build that as well.
Yeah. And what's your ambition for this in terms of, I guess you would love, if you came back in a couple of years' time, that you'd have 1.3 million care workers on your register?
That would be amazing, yeah. And I think actually ambition would be for the government, whatever government it happens to be, to say actually they've listened and they can see the desire, and actually let's make it mandatory, because why is it that everyone else within the healthcare profession, nurses, doctors, OT, all mandatory requirements, and yet care isn't, and yet carers, domiciliary carers, they are, they are taking some of the most responsibility, lone working in the middle of winter in some, rural, where I live, it's really rural, and they walk in to find someone on the floor, and it's for someone who, it is a massive responsibility, and then you phone up for the GP, and basically your opinion is, not opinion, but your voice is not heard because you don't know anything.
Because you're not on a list, or you're not. It's not a recognised
accommodation. Maybe I'll start out as a carer, and then I might not through to thing, but actually I'm a nurse, and the attitude changes like that, and that's not right. That is not right. So.
Fab. So, have you guys got one tip that you can give to people to take away today?
I knew you were going to say that.
Anything else that you want to add to that?
Definitely register, but for me, this is all about businesses becoming an employer brand and putting people at the heart of that, and building that care profession as part of the whole process.
Fab. So, as I said, I've got one last question, which is, we've been having debate as a team about orange juice, and with bits or without bits? Without, okay.
I'm with bits.
With bits too. Yeah, I'm with bits too. Right, okay, well thank you very much for coming.
Can I give you the website?
Yes.
www.vcpr.co.uk.
VCPR.co.uk.
Yeah.
Love it, nice and simple.
Thank you.
I hate the ones with the big long
Thank you so much.